See, unfortunately, the medical establishment is a business like any other business. And business needs customers. And they want to sell you their most expensive item, which is unnecessary surgery. You see, it's in the best interest of the medical profession that you remain sick. See, that ensures good business. You're not a patient, you're a customer.
You know, I like doctors because they don't cure shit. They don't cure nothing. Same disease has been hanging out since I was a kid, man. What's the last shit a doctor cured? That's right, they don't cure shit. Same disease has been hanging out since I was a kid. AIDS, sickle cell, tuberculosis, cancer. Where the the money going? Where's the money going? They can't even cure athlete's foot. Because ain't no money in the cure. The money's in the medicine. That's how you get paid on the comeback. That's how a drug dealer makes his money on the comeback. That's all the government is, a bunch of motherfucking drug dealers on the comeback. They can, but they won't. So what they will do with AIDS is the same thing they do with everything else. They will figure out a way for you to live with it. But they don't cure shit, they just patch it up. Get you to the next stop so they can get more of your money.
In America, where competition prevails, Dr. Benjamin Rush, America's first Surgeon General and the only medical doctor to sign the Declaration of Independence, tried in vain in 1776 to have medical freedom enshrined in the Constitution. He feared that the time will come when orthodox medicine will organize into an undercover dictatorship. His fears were well founded as, in 1839, the American Medical Association was founded and immediately began to ostracize from its ranks the then popular, and what the AMA referred to as the enemy, homeopathic doctors. This practice of shunning the competition has become common practice. Dr. Carl Risch said, "These doctors know what's in the best interest of their careers, even if it's not in the best interest of their patients." Both the FDA and the drug industry refuse to carry out tests on products that they cannot patent and therefore profit from. Since vitamins, minerals, and herbs are all natural substances, they cannot be patented. The FDA, which has been given both the mandate and the money to protect the public, instead chooses to protect the drug industry. The FDA spends our money trying to convince Americans that nutrients may be toxic. This is both hypocritical and ludicrous. The FDA has a terrible track record of prematurely approving drugs and then being forced to take them off the market. These drugs approved and promoted by the FDA have now been proven to be deadly to humans. Robert Barefoot said in an interview with Lee Davis, "Drugs are made by man. Vitamins and minerals were made by God. You're going to have to decide who knew what he was doing."
The fact is, drugs cause lots of deaths, and it makes doctors very nervous.
At least 50% of all medical diagnoses are incorrect. The American Medical Association just refuses to listen to logic, preferring to tread the beaten path of escalating disease treated by unnatural and expensive man-made chemicals. The cost of this stance is massive human suffering and the premature death of millions of Americans. Author nutritionist Mike Adams said, "Some people just don't get it. They think chemicals solve these problems. I've always said that if modern medicine were responsible for treating lawns, they would diagnose a shortage of water as yellow grass disease and prescribe green lawn paint at $100 a gallon to make the lawn look greener. In his book, The Death by Diet, Robert Barefoot said, "The AMA is very biased and usually ignorant of certain medical facts. The regulators of medicine refuse to look at any facts that they perceive may threaten their authority. The Food and Drug Administration, responsible for protecting your health, is content to hold hands with the AMA as America drifts toward annihilation." Despite the fact that massive numbers of scientific studies over the past decades have documented the evidence of the benefits of vitamins and minerals in preventing disease, the FDA may be duped into squeezing the vitamin industry out of business, thereby ensuring the proliferation of disease, which would be accompanied by huge increases in drug company profits. At this time, few politicians would dare support the FDA's active incursion into the vitamin and mineral industry. The process is intended to be gradual, so as not to invoke a massive backlash from the public. The medical authorities are, in large part, economically dependent on the sale of drugs. Both medicine and the drug companies are the biggest benefactors of the ill health in America. The FDA is forcing the public to do as I say rather than as I do, which is a hypocritical position to take. What makes it more ridiculous is that doctors are trained to give this same foolish advice to their patients, causing a great deal of harm to their health. Doctors are given advice by the medical authorities, who are highly influenced by the drug industry, which, under no stretch of anyone's imagination, can be considered to be impartial. The powerful drug industry also contributes heavily to political campaigns. I wonder why. History has recorded many shameful acts by the Food and Drug Administration that resulted in the promotion of human disease, suffering, and death. The FDA has been guilty of ignoring the disease preventative merits of specific foods that could have prevented epidemics while endorsing economically lucrative toxic drugs that have been proven to cause disease. Unfortunately, the doctor is only telling you what he was told to tell you by those with a vested interest in keeping you sick, the AMA FDA Drug Industry Coalition. The irony is that most of these men and women are people of high moral standards who actually believe in what they are doing. But good intentions are not good enough. Many will rush to their doctors for guidance and advice. The doctor is, and always will be, the most respected member of our society. Unfortunately, because of the lack of medical freedom, the doctor's scope of knowledge on preventative medicine has been restricted by the governing establishment to the point where, although he may have opinions and concerns for your best interest, in reality he has no knowledgeable answers. The doctor is just passing on misinformation given to him by the medical establishment, which, despite all the scientific studies, really believes what it is saying. For example, the current recommended daily allowances of vitamins and minerals are ridiculously low, encouraging disease, and are in contradiction to many exhaustive and massive scientific studies.